Good morning. Good afternoon. Sorry. I'm Stacey Pogue with the Center for Public Policy and Priorities, and I submitted as written testimony a report that we just had that came out this morning on what we know at this point about the Supreme Court decision and what impact that'll have on Medicaid and what questions remain. But to quickly summarize that, what I'll say is that the guidance that has come out this far from HHS and what some legal experts believe is that the only part of the Affordable Care Act changed by the Supreme Court decision is the ability of HHS to withhold full funding for the state Medicaid's program if the state doesn't opt to expand Medicaid to adults in or near poverty. We are grateful that the Senate is starting what looks to be a very full and thoughtful conversation about big questions on our healthcare system that will have to be addressed next legislative session. Among them will be whether we take part in the Medicaid expansion for uninsured adults. If we do not do that, we will leave, as we've heard today, billions of dollars, federal dollars on the table, and more than 1 million of our citizens and our residents here are uninsured. We have about 1.7 million uninsured adults today that would qualify for the Medicaid expansion. A small share of them, as we heard earlier, would qualify to go to the exchange if we didn't do the Medicaid expansion. But we have some big concerns about whether they'd be able to afford the premiums in the exchange and be able to afford the cost sharing, because that program was not designed for people at these income levels. But it would leave them 1.3 million Texans, these are uninsured adults, with no coverage option. They would remain uninsured, and it would set up then a system where we actually have people who are too poor to qualify for help, because keep in mind the Affordable Care Act has options for people at higher income levels. These uninsured adults, as we've heard from other folks, will continue to access care. It's not a question of what they're going to get care, it's a question of how we pay for their care and how we organize their care. And that means that our county taxpayers will continue to bear the burden of uncompensated care that is unnecessarily uncompensated care. It could be with the Medicaid expansion, if we chose that route, that we could end up saving more at the county level through uncompensated care than we'd spend on the Medicaid expansion, and that could relieve some of the strain on property taxes. So again, I just want to say that we're grateful that we're starting the conversation about what direction the legislature is going to go in 2013. We think the Medicaid expansion is the right thing to do for our poor citizens and makes some good financial sense too, and look forward to continuing that conversation. Thank you.
Thank you.